So we are going to do a reflexology treatment for shoulder pains on the foot. The reflex areas for shoulder and neck are into this little region, which is the ball of the foot right under the fifth toe. Usually we use a technique called thumb walking, where you use your thumb and you walk up the reflex zone. So as we do the thumb walking, you're going to apply constant pressure as the thumb goes in, and then you walk up. Again, apply pressure, hold it for a couple of seconds, and we continue the technique until we come all the way to the top. Then go back to the next zone, and again, using thumb walking, cover the area, the reflex area for the shoulder reflex as we go up the zone. We can also use the same technique as we go horizontally across the area, using thumb walking, just so that we cover all the points that cover the reflex zone for the shoulder reflexes onto this area of the foot. The other reflex areas that also represent the shoulder are right onto the dorsal of the foot between the fourth and the fifth toe. And we are using a technique called finger walking, where you can use your index finger to walk up in between the metatarsal space. So you're going in between the fourth and the fifth metatarsals, and you're using, again, consistent pressure as you walk with your finger through that little space in the metatarsal. And that usually is the reflex zone and the areas that cover the shoulder for the foot. You're going to do a reflexology treatment for hip and knee problems around the foot. The hip and knee reflex areas are usually in this little area around the dorsal of the foot onto the side of the foot. And it's usually represented as a little triangle, the little swollen area that we have around the top of the foot. So we can use our fingers, again, depending on how many you want to use at a time. But you can use the technique for finger walking, again, moving the first joints of your fingers as you are moving through, applying constant pressure as the finger sinks in, just to activate the reflex areas for the hip and knee, and then sliding back to the original point, again, sliding a little bit behind, and then doing the same technique. We are doing the reflexology treatment for anybody who has low back pain. And the reflex areas for low back pain are at the posterior surfaces of the leg. So the posterior part of the leg here. And as you go down onto the posterior surfaces of the ankle, going down onto the sole of the foot, it goes around, which is generally the low back sciatic region, and it goes around the other side of the foot as well. Usually when it comes down to treatment, we are again going to use the same thumb walking and a combination of finger walking that could be used. So we can start off from the side of the foot here, and this is the area where you have the low back sciatic going. So we will be using, again, finger walking. Again, you can use it to apply different amounts of pressure. If you're comfortable with thumb, you can also use the thumb walking technique as you go down. Again, consistent pressure going across the sciatic reflex and the low back reflex as you go up towards the sides of the ankle and towards the back of the ankle. The reflex movement and the thumb walking could be done about 2 to 3 times as you move across the reflex areas to provide comfort with any conditions that cover low back problems.